Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. The UK has become the first country to approve the Pfizer-BioNTech COVID-19 vaccine, making the first 800,000 doses available next week. Now, while this is being hailed as the harbinger of the pandemic's end, it has come with costs that many are willing to overlook in exchange for a promised return to normality. Joining us on the show tonight, we are delighted to welcome Professor Sanjeev Krishna, Professor of Molecular Parasitology and Medicine at the Institute of Infection and Immunity in London. He's working on an antigen and antibody rapid test kits for COVID-19, as well as point-of-care PCR tests. Now, good evening, Sanjeev. Good to have you on. Interesting developments in the UK. So what was your reaction to the news that the UK has approved this specific vaccine for mass vaccination?
Well, my reaction initially was that Astro AWANI have got the timing spot on for discussing vaccines. This is really a golden moment, I think, and we should just pause and think a little bit about what's happened and what's brought us to this point. We've got a global pandemic which really is less than a year old almost, just about a year old. And it has devastated the lives, the economies, and in fact, the whole global community. And as you say, we've been working on diagnostics, we've had advances on the treatment side, but a huge amount of expectation and hope the scientific and medical efforts began, we really didn't know if it was going to be an achievable goal or not. And what the pandemic has done is to pull together the whole of the global scientific, medical, and research communities, as well as industry, as well as regulators, and as well as people who are participating in these trials, to deliver at record speed what is going to be, I think, the first of several vaccines. So it is a golden moment.
Sanjeev, Sanjeev, do you think there's some downside to this, to use a phrase that I think Donald Trump coined, warp speed development of this vaccine? The kinds of things that you've observed as a scientist and a clinician, are you concerned about those elements of the way the vaccine has developed?
It's a very important question, Sharaad. I listen very carefully and I look very carefully at the evidence. And one of the, in terms of safety, for example, as things are being developed, and one of the, if you like, issues that has arisen in the way that the pandemic has unfolded is often, as scientists and clinicians, we don't see the full evidence until a little bit later. So we hear in the press what's going on. Now, when it comes to what President Trump says, I think we put that to one side. We stick to what the evidence is. And what we heard this morning in the press conference from the regulatory agency here in the UK that has approved the first vaccine was a very detailed summary of how carefully they have been evaluating the whole development of this vaccine, especially and more than anything else from the point of view of safety. So as far as we can tell, those of us who are not actually in the process directly, all the assurances, as far as I'm concerned, are in place to give me great confidence. So if you ask me, Sharaad, would I be willing to have this vaccine today, I would say I don't have any hesitation in saying yes.
Okay, but I do want to talk a little bit about the process, though, because while you say there was a detailed summary announced today, if you look at the protocol before this, it's not been according to the usual practice. Think about the announcements about the vaccine, all done by press release. There's been incomplete information up to this point, and this kind of attitude that seems to suggest, well, just trust us. How do we think through this, about that this is a slightly unusual practice? Should we not be concerned at the speed to which this has been rushed through?
Again, it's a very important point you're making, Melissa. And what I would say is, 1 week in COVID time is like 2 months in the real world. And so we won't have to, so what I mean by that is that we won't have to wait too long, probably just a matter of a few days, before data start to come out for us to be able to look at in detail. But the actual process that has allowed the regulators to come to a conclusion that this is safe has been explained extremely fully, and including with questions and answers in a press conference. And I know that they have not, from the way that they've described things, that no corners on safety have been cut. Remember, 40,000 individuals have been entered into trials. That means that about 20,000 people in this phase 3 study for the vaccine that's been approved actually received the vaccine. And we know that there were no serious adverse events, that the usual types of vaccine-related events occurred, a little bit of soreness, a little bit of fever, and so on, but that the effect in preventing disease was really, I think, surprisingly good. Because when you started out without having a vaccine, the bar was set quite low. I think people said if it is 50% effective, then, that's good enough. And this is now over 90% effective. Remarkable.
Sanjeev, what about the question of the British public? Do they suffer from the problem of vaccine hesitancy? Are there anti-vaxxers in Malaysia? And I don't know about how Britain scores on that in that regard, but what is that, and what impact could that have, reluctance on the part of the British public to take the vaccine?
Well, this is a very important question, and I think a large part of it depends on how messaging comes across clearly, that this is now safe, that this is effective, that the quality of the vaccine is being maintained, and that it really can change people's lives in terms of the risks that they run. There is, I think, unfortunately, in the current social media era, which we're all in, there is this echo chamber which amplifies some of the anti-vax misinformation that there is. I come from an institution, St. George's in the University of London, where the father of vaccines trained, Edward Jenner. And so, for me, this whole process of developing vaccines is a critical one. It's been one of the most important benefits to humankind in the whole history of medicine. And we should remember the benefits always when we come to appraising new vaccines, especially something like the BioNTech one, which is a new technology, but which I think has now met all the right safety standards by all accounts.
Well, there are also, apart from the Pfizer vaccine, there are also many other candidates. And we're going to take a quick break, but Sanjeev, we'll have you stay on the line. We'll come back and talk a little bit more about all these other candidates. We'll be back with more on Consider This. Stay tuned. You're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Let's continue our conversation with Professor Sanjeev Krishna from the Institute of Infection and Immunity in London. Now, Sanjeev, along with Pfizer's vaccine, we have many other vaccine candidates that seem to be on the cusp of approval. And I'm sure that this complicates the decision that policymakers around the world will have to make. How would you, Sanjeev, like policymakers to think that through and make the comparisons between these vaccine candidates, taking into account their local context?
That's a big question, Melissa. And I think the first thing to say is that the world needs a large number of vaccines, and no single supplier could supply them. The second thing to say is that, of course, the vaccines must be affordable and accessible. And part of that process also involves having different suppliers and also different types of vaccine. Now, how does one deal with different vaccine types and different manufacturers? The answer is that they are all held to the same standards. So they all have to meet criteria for safety, for the fact that they work, and however that is defined, and also that the quality of vaccine production is good enough. And each country has its own mechanisms. Sometimes countries are happy to take into account the regulatory results from another country. The European Union has a unified mechanism, for example, and these standards will be applied to every vaccine candidate that comes along, and each one has to be looked at individually.
Sanjeev, do you think there are specific issues that pertain to the global south, to the developed or the developing and underdeveloped worlds, in terms of their relationship to big pharma, their relationship to building institutions that have independence in decision making when it comes to regulation and and choice when for a vaccine candidate?
I think, Sharaad, maybe you are referring a little bit to what is called loosely vaccine diplomacy. The way that the countries that manufacture vaccines or have industries that manufacture vaccines within them, how they are interacting internationally to deliver or to secure the supply of vaccines. And these are very complicated matters, of course, and they go well beyond an academic's framework of thinking. All I would say is that our impulse, our direction, is that safe vaccines, which work, really should be made accessible to the people who need them most. Because, Sharaad, that one of the features of the COVID pandemic is that it has highlighted and exacerbated the differences between the haves and the have-nots, both within societies as well as globally. And so I think a vaccine stands the chance of being an equalizer, but it will only work as an equalizer if it is available to those who are the most deprived as well as everyone else. Because let's not forget, COVID-19 does not respect any status in society.
Right, so the idea is to have the vaccine available to all, and I want to talk to you about this access to everyone so that everyone is protected. How do we think that through in dealing with perhaps segments of society that do not have access to the vaccine? I'm thinking about, in a Malaysian context, perhaps undocumented foreign workers, those who are stateless, or those who are even sometimes socially invisible. How would we deal with that?
I think this is a very important general question because, of course, whilst it applies to Malaysia, it also applies to many different parts of the world, including perhaps well-developed nations. Now, the issue has to be that health cuts across all other societal barriers, in my view. So it must be made very easy for people who perhaps are undocumented to at least gain access for health reasons to vaccines such as this, and other healthcare as well. Because after all, health is one of the fundamental human rights that we all deserve access to in terms of vaccines, in terms of good water, in terms of food, and so on.
Sanjeev, perhaps the question of context, as say Britain or Malaysia, where you have a fairly well-developed public health system, the NHS in your context, here in Malaysia, but Malaysia also has a very mixed system with a lot of private, suppliers of healthcare, and there is this issue. The government's already announced that it will provide the vaccine free of charge to all adult citizens. They will be provided at cost to, or at some cost to foreigners. The question is, do you think there might be a run on the supply, that there might in fact develop this real need, hunger to kind of jump the queue to get these vaccines?
Yes, that's the natural human impulse, isn't it? Protect family, protect friends, protect oneself. I think there is a bigger idea here, which is that we can't protect ourselves until we've protected everyone, and that's the nature of a pandemic. Because if there are sections in society that aren't protected, that will always have repercussions. So if we start thinking with the biggest impact on society, and if we start implementing in that way, then I think we really will reap the greatest benefits for everyone.
Sanjeev, a quick question, since you're a scientist and clinician, I mean, something that anti-vaxxers in Malaysia are already kind of beating their drum about, which is the methodology behind the Pfizer vaccine, that somehow it's going to affect our genetics, and that's something that's being put out there in social media. As a scientist, does that make sense at all, this conspiracy that will somehow perhaps grow horns as a consequence of taking the Pfizer vaccine?
My goodness, the misinformation gets more and more involved, doesn't it? Genetics in the human context in us is our DNA. The Pfizer vaccine is not DNA. It's RNA. And the RNA is just the instruction to tell the cells to make the right protein, which then allows the body to become immunized. And actually, if anything, it is one of the simplest routes to generate immunity, to generate a benefit from the vaccine. So mechanistically, there is no link between the vaccine and our DNA. And so really, that is very much in the category of misinformation.
Well, thank you so much for clearing that up for us. Now, we're going to take another quick break, but there's still so much to cover. So we'll come back and continue this conversation, Sanjeev. Stay tuned to Consider This. Thank you so much for staying with us on Consider This. I'm Melisa Idris, with me is Sharaad Kuttan, and we're chatting tonight to Professor Sanjeev Krishna of the Institute of Infection and Immunity in London. Now, Sanjeev, underscoring the pandemic's public health response, but perhaps not getting as much attention as perhaps the vaccine race, is our diagnostic tests and therapeutics. Now, you've done a lot of work in the development of antigen and antibody rapid test kits for COVID-19, as well as point-of-care PCR tests. Could you talk to us a little bit about that, specifically also the repurposing of drugs and therapeutics?
Yeah, thank you, Melissa. This is a subject which is very, very close to my heart, because actually between Malaysian groups who are researching, the University of Malaya, Professor Adiba, for example, and our own work here with Dr. Yolanda Augustin in St. George's, we've been nurturing a center for affordable diagnostics and therapeutics. What we wanted to make diagnostics, make medicines that are really to the highest standards, but which people can afford, so that people in areas that are deprived are not excluded from having access to these. So, for example, when it comes to the COVID pandemic, we work with a company which is aiming for minimal returns, so that everything that they make is designed for affordability and access. And this includes point-of-care tests, also for the diagnostics for SARS-CoV-2, for COVID-19. Now, when it comes to the vaccine, we must remember that the vaccine is only one tool. Let's say, for example, we wanted to have a passport which showed us that we were immune to COVID-19, so that we could go about our business, travel internationally, and so on and so forth. We would still need really good quality, reliable, affordable diagnostic tests to show that the body has responded appropriately to the vaccine. So we need diagnostics still, and we will continue to need diagnostics, whether it's the point-of-care PCR test, another company that we're working with, or whether it's for the quick antigen test. Either of those, we will need these for the next few weeks and months. And I think, in principle, it's very important to remember a vaccine is a key part of the overall toolkit, but we still need all the tools, and we need to keep our guard up when it comes to this pandemic, because things are not going to happen quickly.
Sanjeev, what has kept diagnostics and therapeutics, the cost of which, high? I mean, why is it that your effort is something that's been worked on now, considering that, before COVID-19, we've had so many other diseases to deal with? What's the structure of the system that's actually made your efforts necessary at this point in time?
Ooh, that's an interesting question. I think the speed at which we've had to develop things has meant that people have taken risks in terms of, let's say, not necessarily having all the results in hand before being able to say, okay, this is a test that will be useful in these circumstances. And so, with those risks comes a cost, because some tests don't make it, and you're paying money for it, and so on and so forth. And of course, there are opportunities for people also in some areas if they wish to exploit the speed at which things were moving. But as time goes by, as systems become mature to evaluate, as we understand more about the disease, I think things settle into a more reliable and also a more cost-effective method of producing things, because you understand the value of the test, the production can be scaled up confidently, and then after that, things can become affordable for the greater good.
Sanjeev, I like that you brought up that vaccine is only one tool. But earlier today, I think UK Prime Minister Boris Johnson said that it's the protection of vaccines that will ultimately allow us to reclaim our lives and get the economy moving again for the UK. I'm wondering whether you agree with that. Is that true? I mean, if we have a vaccine, are we going to be seeing a return to normality?
Well, it depends how long the view is that one is taking, I think. And I think during the long view, in the next few weeks and months, we very much need all the tools that we have. We need rapid testing. We can't get this, vaccines out to everybody all at once as well. This is going to be one of the biggest global efforts to vaccinate populations ever that there has been. So, in a sense, there's a great excitement. In a sense, the impatience to deliver the vaccines has brought this fantastic first result, and we hope many more. But at the same time, we must also learn our patience, lessons of patience, so that we don't drop everything else because the vaccine is here.
Sanjeev, future pathogens, aiming their crosshairs at the human race, and also older diseases, neglected diseases, something that you, I understand, very passionate about. How are we going to, kind of grab the nettle of that problem of why we've neglected so many diseases and not given it the kind of attention that we've given COVID-19?
Sharaad, again, you've touched the question very close to my heart. I was fortunate enough to be part of a consortium, big consortium, small part, on the Ebola vaccine response for the Ebola pandemic 2014-15, which you may or may not remember. Now, there were lessons that we learned then that we kept saying, please be prepared for pandemics. Please be prepared for the next outbreak of infection. And unfortunately, within a short period of time, those lessons fell on deaf ears and people moved on. Here, now, we are in a situation which is clearly caused global impacts, which are going to have scars for a long time to come across economies, if you like, in nations, and also for individual people. I don't think, at this stage, we can afford now to forget this lesson. And I really think that we need supranational structures, we need supranational organizations that take an urgent responsibility to make sure that we are ready in every way, with diagnostics, with the ability to generate vaccines, with treatment protocols ready to go into action when needed.
Sanjeev, thank you so much for speaking with us tonight. We've been delighted to speak to you, and thank you for sharing your insights. All the best with the good work that you're doing. Thank you.
Great pleasure. Thank you.
That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.